Welcome. My name is Adam Torbicki. I'm one of the 3 vice presidents of the ESC, and I'm very happy to be here together with the leadership of one of our 19 working groups, the working group on acute cardiac care. Professor Christian Vrints and Professor Peter Clemmensen, the chair and vice chair of the working group. Maybe we should start with the definition of your area of activities. What is actually acute cardiac care?
Maybe our vision about cardiac care has been revisited during the last 2 years. If we go back to the start of our working group, originally we were focusing on the care that is delivered in the intensive cardiac care unit, but we have revisited our mission and we have a broader view on what is acute cardiovascular care. We want to improve the quality of care and the outcome of patients with acute cardiovascular disease, and this from the start of the symptoms in the pre-hospital phase, upon admission in the emergency department and the ICCU, until discharge 7 days after the ICCU. And we want to improve the quality of care and the outcome of the patients.
It seems very interdisciplinary. Acute cardiac care should involve many specialties. So are you benefiting from the networking opportunities in within the ESC?
Yes, if I can take that one. Certainly we have been very successful in the past of including renowned faculty to our conferences to make sure and stress that indeed we are multidisciplinary. So we have physicians from other specialties like cardiac surgery, because we have acute valve disease, obviously, that involves the surgeons. Also resuscitation, European Resuscitation Council, we have had very good relationships with them, and we have created joint session during meetings.
So a true cardiology, one might say. In fact, the reason why we are here today is that the working group has just become an association on acute cardiac care. What was the road to this very important moment? What were your achievements that permitted to move towards an association?
It's indeed a very special day for us today. We are all thrilled with this move towards from a working group to an association, and it is the fruit of very hard work during the past 12 years. And we have done a lot of activities with the working group. We have written numerous position papers, and we have organized many sessions at the ESC Congress, but also we have organized initially a biannual Congress dedicated on acute cardiac care, but also we have organized activities for education. We have recently been involved with the setup of the new electronic learning platform, that also will start at this ESC Congress. We have a new journal from this year on within the family of the ESC journals dedicated on acute cardiovascular disease. And so we have been very successful, and it has always been our dream to become an association, and I think we got the support of many cardiologists in Europe. And the last 2 years, we have observed that the number of members of our working group has almost doubled, and today we have more than 1,300 members. So we are the biggest working group of the ESC, and therefore we think we merit 100%, if not 200%, to become an association of the European Society of Cardiology.
And this was indeed the opinion of the board. I had a great pleasure always to report about your activities, and the board unanimously voted for it. But now we expect something in the future. What would you suggest? What would be your main areas of development in the future?
Of course, we look very much forward to working and be productive, and to be a great support for the ESC board and all the activities of the ESC families. What we can do for our members is to empower all the disciplines, physicians and also allied professions that work in the acute setting. So it's really try to empower and get the old virtues and the importance of the classical coronary care unit back, the intensive care unit and all the challenges that we're faced there. And like Christian said before, the pre-hospital phase. So I think this is what we can do, and as already alluded to, we have a number of educational, textbook and other services that would be an ideal platform for our members. Also, we have a very open process with 6 committees covering all of our activities that will be open to the membership to join and to be voted in.
I think it's a very good opportunity also to invite everybody to your meeting, which will be very soon. Can you say something about it?
Yes, we are looking forward to a meeting in Istanbul, and we hope that it will be very successful. And in addition of scientific communications, there also will be a major emphasis on education. 1/4 of this session will be dedicated to challenging cases that will be discussed with the faculty and with on an interactive fashion with the audience. So there will be a lot of opportunities for education as well as training during our Congress in Istanbul. And I would like to invite with this many cardiologists to come to Istanbul. It is a nice place, but it will be also a very interesting Congress.
Thank you very much. I'm coming, so I think many other people will come also. Good luck for your future association, and thank you very much for the interview.
Thank you very much.
Thank you.